So now this topic is about the post-traumatic stress disorders. So firstly, we define what is the disorder. Basically, the post-traumatic stress disorder, which is denoted with the PTSD, is a psychological condition that develop after exposure to traumatic events, and it's characterized by persistent fear, intrusive thoughts, and emotional distress. A central feature of this disease is the disruption of memory processes, where traumatic experiences are stored and recalled in a fragmented and emotional intense manner. So, understanding the science behind this disease and memory help to explain why individuals relive traumatic events through flashbacks and avoidance. And it is provide a foundations for effective evidence-based psychological interventions. So, what firstly we define this disease? Basically, the PTSD is a psychiatric disorders following the exposures to traumatic event. The common triggers are the war, abuse, accidents, natural disasters. The core symptoms include the intrusive memories, avoidance, negative moods, and hyperarousals. Memory disturbance is a central feature of psychiatric disorders. So, what is the trauma? Basically, trauma is a psychological and physiological response to an event or series of events that overwhelm an individual's ability to cope, making them feel helpless, threatened, or unsafe. It is defined not only by the events itself but by how the brain and body experience and process that events, often leaving lasting effects on emotions, memory, and the behavior. For example, a person involved in a serious car accident may survive physically, but later experience panic vivid memories of the crash or fear while driving, showing how the events continues to affect the mind and body even after the danger has passed. What is the memory? Basically, memory is the mental process by which the brain encode, store, and retrieve information, allowing the individuals to retain the experiences, knowledge, and skills over time, and use them to guide thoughts, emotions, and behaviors. For example, remembering your first day at university, what the classroom looked like, how you feel, and what the teacher said is an examples of the memory, as the brain store that experience and later retrieve it when you think about it. Now, what is the investigating the science behind this disorders? Basically, there is the memory system in the brain. That may be the expect memory, which is the consciousness recall, like the facts and the events, and impact memory, such as the unconscious memory, which is the emotional response and the body reactions. So, this disorders mainly disrupt the autobiographical and emotional memory system, such as the encoding. Encoding is basically registering the informations, and consolidation means stabilizing memory over time, while retrieval is the recalling the stored information, such as the trauma interferes with all three stages of these behaviors. So, investigating the science behind this disorder, for example, the role of the amygdala. Amygdala is where present. Basically, the amygdala is the small almond-shaped structure in the brain that processes the emotions, especially the fear and the threat, and play a key role in forming the emotional memories and triggering the body stress response. Amygdala process fears and the threat, and it become hyperactive during the trauma. So it strengthened the emotional memory encoding and triggered the strong fear responding during the reminders. What are the flashbacks? Explain. Basically, the flashbacks are the hippocampus and the disorders. Hippocampus organize memories in time and context. Right? Hippocampus volumes and functioning lead to fragmented and disorganized the memories. Difficulty will become disorganized and pass from the present. prefrontal cortex dysfunction, such as the prefrontal cortex regulate the emotions and fear the responses. During this disease, regulatory control is weakened and reduce the inhibitions of the amygdala activity, which result in the poor emotional regulation. Stress hormones and the memory, such as the cortisol and adrenaline released during the trauma, show in the short term enhance the emotional memory, while in the long term it damage the hippocampus memory, alter the memory consolidation process. In the main way, flashbacks such as the flashbacks are not ordinary memory. The experience as happening now. It triggered by sensory cues caused by the failures to integrate the memory into the narrative forms. Memory suppressions and avoidance. This disease also involved the active avoidance of the trauma reminders. It suppressed the memories and remained the emotionally active. Avoidance maintain the symptoms severely and prevent the healthy memory processes. Flashes and destroyed memory. For example, trauma can lead to the memory gaps or distortion. Memory reconstruction influenced by the emotions and the context. So these disorders increase the vulnerability to alter the recall and its important considerations in clinical and legal setting. So, what are the types of the memory affected in this disorder? Basically, the autobiographical memory, this refers to the memory of the personal life experience, including the events, the peoples, and the places. This disorder, these memories can become fragmented or incomplete, making it difficult for individuals to recall the trauma as a coherent narratives. Emotional memories, these are the memories tied to strong the emotions, especially fear. This disorder often strengthens the emotional memory, meaning that traumatic events trigger the intense emotional reactions even when the situation is no longer dangerous. This explains the flashback and heightened the anxiety. So there is some types of the memory affected in these disorders, like the contextual memories. This involve remembering the context of an event, such as when and where it happened. This disorder often weakens the contextual memory, causing the confusion between the past and the present experiences. For instance, a person may feel as if a part threaten is happening now because the brain failed to place the memory in the correct time and the space. Neuroplasticity and this disorder, basically brain and therapy. Brain remain the capable of change. Trauma alters the neural pathways and the therapies can reshape the adoptive memories network. So recovery involve reintegrations of these memories. Therapeutic approach targeting memory. Trauma focus the CBT, right? EMDR, which is the eye movement desalination and the reprocessing. Prolong the exposures therapy and aim to replace the therapeutic memory safety. So, what is the EMDR and memory processing? Basically, EMDR stand for the eye movement desensitization and reprocessing. So, as a result, it can be introduced that it's used the block stimulations help to recode the traumatic events and reduce the emotional intensity, support the adaptive memory integrations. PTSD, memory, and the identity. Traumatic memories shape self corrections, register the through perceptions, and memory disruption complete and give a identity correction. There is also some implications for the psychology, such as the mind brain interaction. So, PTSD show how thoughts and emotions are linked to the brain activity. Trauma informed information guides safe, supportive, and individualized treatments. Better diagnosis treatments like understanding the memory disruptions help to tailor effective therapies. Ethical responsibility protect the participants' safety, privacy, and well being during the memory work. So, as a concluding mark, PTSD is a fundamentally a disorders of memory processing. Trauma altered the brain structure and memory systems. So, scientific understanding guides effective treatments and it integrating the memory restores psychological well being. Thank you so much.